Deputy Brady, 4 minutes.
Thanks, Les Corla. Minister, direct provision is one of the greatest shames of our time. Currently, there are thousands of people in prison conditions of direct provision, powerless to change their circumstances. There is public outcry on this, and yet you and your department continue to line the pockets of private interests while people suffer. As of this year, the situation for those fleeing for protection has gotten even worse. The Reception and Integration Agency are now accommodating 872 people in 28 emergency accommodation centres, 2 of which are in my own constituency of Wicklow. The Journal reported last week that, according to a spokesperson for the Department of Justice and Equality, it now requires a cultural liaison service to help people living in emergency accommodation, and has issued a tender for NGO services to provide social services like access and medical cards. Your department says it needs this service in place as soon as possible. From my experience, Minister, this is true of the temporary accommodation centres in Wicklow. I am hearing from many constituents and contact with community groups like Bray, Refugees, Solidarity and MASI that these temporary centres are falling completely below any acceptable standards. And indeed, the lack of social welfare support is glaring and totally unacceptable. For example, in terms of medical care, in response to a parliamentary question that I tabled, your department stated that the RIA is liaising closely with the HSE to facilitate appropriate service provision to them while in emergency accommodation. Yet I am hearing reports that residents in Wicklow had been given insufficient information on medical card entitlement and how to access them. Some of the residents in temporary accommodation did receive medical cards only after members of community groups sourced forms, approached GP clinics, received refusal letters and sourced suitable GPs willing to take on some residents. Minister, what did your department do to ensure medical care was provided as soon as these asylum seekers landed in temporary accommodation in County Wicklow? Again, in terms of looking after the most vulnerable children in temporary centres, in response to a parliamentary question I tabled, the department stated, children of international protection applicants who are residing in emergency accommodation can access school places in local primary and post-primary schools in the same manner as the general population. They can avail of the back-to-school clothing and footwear allowance, which is administered by the Department of Employment Affairs and Social Protection. Again, by many reports, this did not happen in the temporary centre in Bray. I ask you, Minister, exactly what steps did your department take in terms of both the temporary accommodation in Ashford and in Bray? I ask you, Minister, exactly what steps did your department take in terms of both, I ask you what actions did you take for the centres in Ashford and in Bray to ensure that the children in these centres were registered and supported to get into local schools? What contact did your department or maybe the Department of Education have with the local schools to ensure that school places were available every day that a child is out of school outside of their new community is an absolute disgrace? So, Minister, I'd appreciate if you could answer some of those questions.
Minister.
Under EU and international law, Ireland, as the Deputy will be aware, is obliged to examine the claim of any person who comes here and claims international protection under strictly defined grounds. While an international protection claim is being examined, the State offers accommodation and related services to anybody who requests it. This includes all meals, medical care and utilities. A weekly personal allowance is paid to each person, and the Department of Employment Affairs and Social Protection cover exceptional needs. The Department of Education and Skills provides school places for children who may be resident in the centres, and children also have access to free preschool schemes. early childhood care education programme. The HSE provides mainstreamed health services to residents. It's a whole-of-government approach to supports and services for applicants. As of the 7th of July, the Reception Integration Agency of my department is accommodating 6,082 people in its 39 accommodation centres, and a further 988 people are in emergency accommodation. The use of emergency accommodation is suboptimal. It doesn't allow for the full range of services to applicants that the traditional centres provide. However, the state must ensure that each person arriving in Ireland today to claim protection has shelter and food and any urgent medical care required. RIA has arranged the provision of emergency accommodation for international protection applicants since September 18 due to the increasing numbers of people arriving in the state seeking international protection. RIA has reached full capacity in its centres at that time. RIA is committed to using emergency accommodation for as short a time as possible and is actively working on securing additional capacity, both in existing centres and through sourcing new centres via a national procurement process. The use of such accommodation naturally incurs additional costs to the state, with expenditure this year likely to reach or exceed €120 million. Residents in emergency accommodation are offered medical screening, funded and managed by the HSE, located at the Balseskin reception facility, for the purpose of assessing recipients who have just arrived in the state. In addition, arrangements are in place in various parts of the country to offer this service to those who do not avail of it in Dublin. RIA is also seeking to contract a visiting support and cultural liaison service from the NGO community to assist those residents during their time in emergency accommodation. Residents in emergency accommodation can address any issues directly to RIA. They may also contact the Ombudsman. They may also contact the Ombudsman for Children if any issue is not resolved to their satisfaction. Additionally, RIA has facilitated visits by the Office of the Ombudsman to a number of emergency accommodation locations to meet with residents and discuss any issues that may be a source of concern or that may arise.
The Deputy has 2 minutes.
Thanks, Minister. Now, unfortunately, you didn't answer any of the questions I put to you, and I note in your response that the number of people in emergency accommodation has jumped up to 988, as opposed to the last information that I have stating it was 872. Minister, there's countless more issues that I could bring up in relation to the people in the emergency accommodation, everything from packed lunches to the way that residents are moved without adequate warning from temporary centres to direct provision. But I'm conscious I'm short of time. But my urgent point that I want to hammer home to you today is that direct provision is totally unacceptable. And temporary centres are an unbelievable extension of the horrific nature of that system. And to be honest, we didn't think that direct provision could get worse, but temporary centres have proven that they could, and it can. And I urge you, Minister, to prioritise addressing this. In Wicklow, it seems that there is a complete absence of basic social welfare provision to asylum seekers in the temporary centres, and this goes against what your own department state that should happen. And again, I urge you to review it and intervene in those situations, because only through the likes of Brave Refugee Group and other organisations out there, the people, the most vulnerable people that this state is given protection to, they would not be getting what they're supposed to. Only these people going out and speaking directly to GPs are these people accessing medical cards and GPs. There's serious problems, Minister, and you cannot stick your head in the sand and say we're looking at expanding the direct provision system. It needs to be dismantled. The whole system of the emergency accommodation, the substandard accommodation that is provided, it's failing these people, Minister, and you know that, and you need to address it immediately.
Yeah, I want to acknowledge the fact that there is a demand, that there is a significant demand, and to meet that demand, my department has sought to identify additional accommodation by publishing expressions of interest in the national press as the current accommodation portfolio will not meet that demand. And the Deputy is right, the numbers are increasing, and the increased numbers has put pressure on the current arrangements. RIA will continue working to identify additional accommodation centres and emergency accommodation. The need to resolve the issue of suitable Main Street housing for over 700 people currently residing in accommodation centres who have been granted status, who have permission to remain in the state, is a key part of the process. Helping those people transition into mainstream housing will free up capacity to ensure that people remain in emergency accommodation for as short a period of time as possible. These people are being assisted by agencies. I want to acknowledge the work of DePaul, Ireland. I want to acknowledge the work of the Peter McVerry Trust to move into mainstream longer-term accommodation. RIA's regional procurement process is advancing, will be continuing throughout the year. Following the assessment process, as RIA identifies new centres to be opened, coordinated communications will be initiated, including with all the relevant local authorities and state partners. I note what Deputy Brady has said in respect of the health services, in respect of the HSE, in respect of GPs. I note what he has said in relation to the matter of education. I would be happy to assist in seeking to achieve early resolutions to these issues involving agencies and departments, the Department of Education, the Department of Employment and Social Protection and the HSE.